So our last feature of today's Real Health Medicine Cabinet is a cough syrup that's been formulated to treat infections, to help shed some light on the causes, the symptoms, and the treatment of respiratory infections in children is Dr. Leon Strauss, who's a homeopathic doctor. And welcome to Real Health for the first time, right?
Thank you. Yes, it is the first time.
It's good to have you with us. So when we talk about respiratory infections in children and their underdeveloped immune systems and hypersensitivity, what exactly makes them more susceptible to it from a biological, physiological perspective?
You know, children's immune systems are built, not born. They're born with a clean slate. And they need to be exposed to the viruses out there. With 320,000 viruses estimated to affect human beings, they're overexposed. And they need to develop a tolerance as well as get rid of some of the viruses and build up antibodies. And this takes a lifetime.
Are they not sometimes underexposed as well? Because, you know, the gene hypothesis, and we tend to live in sterilized environments. So when something comes along that their immune systems are unfamiliar with, you know, it also presents challenges. Absolutely.
The hygiene hypothesis stems from children not being exposed to children of a similar age at from young. And essentially not being allowed to play in the dirt. So their immune systems never get a chance to develop, and later on they develop abnormal immune reactions such as autoimmunity or severe allergy for unknown exposures and random exposures. So yes, they need exposure, adequate exposure, and enough time to heal between exposures.
Okay, and what are some of the irritants that can cause these respiratory infections? Are there any that we're unfamiliar with or not really cognizant of?
Viruses are our biggest source of infections with children. And there are many they have to go through and develop a resistance to. Outside of that, the bacteria and bacterial resistance is a major problem, as well as chronic conditions like asthma. Children that have croup tend to get recurring croup. Respiratory syncytial virus, which is a cause of bronchiolitis in children, tends to recur and cause lung damage over time. Pollution is another major factor that causes kids to pick up more infections than they should be, as they keep trying to shed the pollutants from their mucous membranes. And that provides a breeding ground for infections to take hold, especially the bacteria.
Toxins in things like crayons and, you know, certain pencils or even paper, is that something that you see within your practice, or is it not? I mean, you see a lot of non-toxic options on the market, but previously, is that something that would be a major irritant for children?
Certainly, but it's more the inhaled substances that cause irritation on the respiratory membranes and hypersensitivities to certain substances. So it smells and scents. Pollutants in the environment that can be inhaled are a major cause because of the irritation.
I've also read that sometimes moms and dads have had to change things like perfumes, you know, unknowingly and unwittingly. That could be an irritant for their child as well.
Certainly, especially if they become hypersensitive to any of the ingredients, any of the excipients in the products.
What about dietary irritants?
There are foods that aggravate the mucus in the body, especially causing the body to produce more mucus or thickening the mucus so that it cannot be excreted at an adequate rate. So homeopaths used to talk about white products, milk, bread, sugar, big irritants to the immune system as well as the mucous membranes.
And I suppose the challenge then with children is that staple diet in school. How do you, you know, as a homeopath, help moms and dads start changing some of those dietary items? What would you recommend as substitutes instead to help reduce inflammation in the body overall?
Decrease the amount of foods that cause inflammatory and acidity in the body, and that really comes down to sugar, and moving back towards more natural whole foods. And I always say, in terms of nutrition, get back to foods with a single ingredient, like a carrot or an apple, as opposed to prepared, commercialized foods that contain a lot of additives that the children could be reacting to.
How do you know when a cough is serious?
Coughs in children are difficult to judge from purely hearing the cough. If it's been going on for weeks and not changing, I would recommend professional help. And as soon as the cough starts producing sounds outside of a clear cough, that's when it starts becoming more serious. So you may hear whistling from the chest, crackling,
wheezing,
what we call a stridor when they breathe in. Any additional sounds outside of clear breath sounds is an indication that they need more help to clear it.
What about phlegm and the color of phlegm? When is it something that parents should be concerned about? Or when is it, okay, it's still a little bit safe right now?
Traditionally, we've seen coloured phlegm as a cause for fast intervention, but I think that's changing. Thickened phlegm means the immune system has taken up a few steps and it's starting to thicken the mucus. It's slowing it down from spreading, and the colour is often breakdown products of inflammation as well as bacterial cells in the phlegm, as well as white blood cells infiltrating the mucus from within the body to take the fight further to the next level. But we also need to accelerate the removal of that phlegm.
Some questions that I've seen on social media which are quite fun. How do cough syrups actually work? Because if I'm swallowing a cough syrup, it's not going into my lungs, it's going into my stomach. And how do vapor rubs work as well to help alleviate respiratory infections or to calm respiratory infections?
Cough syrups are a traditional medication, and they certainly do soothe the mucous membranes as you swallow them and soothe the irritation, especially in the upper respiratory area before you hit the trachea, the windpipe. So soothing on the upper respiratory area does provide some relief.
Okay, so our product in our medicine cabinet, our final product for today is Stodal. Tell us what sets it apart. Why is it so unique? You mentioned that it's got a mixture of homeopathic and herbal ingredients. So because we're talking about respiratory infections in children, it's safe to assume it's safe for kiddies.
Absolutely. Very safe for kids. And you can change the dose quite easily. 2.5 mils for kids under 5 years old is the correct dose. And what makes it unique is it's safe for all ages. We do not recommend it for under 1-year-olds because self-medication is discouraged at that age. The other major uniqueness about this product is it has a mixture of 3 herbal ingredients with homeopathic ingredients in a fairly low dilution, so there is still physical substance in the product. The combination of the herbal ingredients allows the product to be used as a mucolytic to thin the mucus. Some of the ingredients has a history of being used in emphysema, so the product will help get mucus out of the lungs in the more serious wet cough type pictures.
And it's for coughs and colds.
Yes.
Talk to us about that.
Colds are very varied in how they present. A cough can be caused by sinus, it can be caused by an irritation in the throat area, in the laryngeal area, for whatever reason. A cold is a viral infection which will have its own upper respiratory symptoms which can step down and go deeper into the body. The product has ingredients in it that works on sinus as well. So as soon as you have a cough, you can expect some sinus involvement and postnasal drip.
Also, what's the best way to take a cough syrup?
Before meals, on a clear mouth. With children, I forgot to mention earlier, you can dilute it in a bit of water.
I see that,
because it is fairly sweet.
For babies and infants and for children.
But certainly more frequently, every 2 hours with a persistent cough, there's no problem increasing the frequency of dosage. In fact, with a lot of the low dilution medications, increased frequency gives you a better result as opposed to 1 or 2 large doses. So increase the frequency if the cough is more severe and decrease it as it improves.
Is it safe to take with other medication?
Absolutely. You can take it with other medication. You can take it during pregnancy. The only concern is with diabetics, they need to monitor their caloric load if they are taking the product. It does have some sugar in it.
Yes. And where can people find it?
Most health stores in the country, as well as the bigger pharmacies, definitely keep it. It's been on the market in South Africa for over 30 years now, and it's very much a household name. It was when I was growing up. So you will find it readily available to purchase.
Fantastic. Well, thanks for joining us in Real Health.